My name is Dr. Michael McNamara. There are many conditions of the skin that cause redness, and two of these, for example, that I've seen are very common is eczema and psoriasis. Now, these two conditions are completely different in origin. Psoriasis is a mostly hereditary phenomenon that's what we call autoimmune. It's the body's immune system reacting against ourselves and causing a certain amount of redness in various parts of the body. But not only redness, it causes the skin to become thicker, it causes the scaling, flaking, and it's quite disfiguring, and it's also quite common. This causes redness because of inflammation. What we need to get rid of the inflammation, to reduce it at least, is an anti-inflammatory substance such as vitamin E. So what's important is to apply a topical formulation, topical skin cream containing vitamin E, because it's anti-inflammatory, reduces the redness and the appearance and actually the thickness of the skin in patients suffering from psoriasis. Now, another condition that's also very common is eczema. Now, eczema can occur in a wide variety of ages. It can occur in children, adolescents, adults, and any age. Eczema is actually an inflammatory condition. Sometimes we think it could be allergic in origin, sometimes intolerances from soap and detergents that you use to wash our clothes. We don't really know what causes eczema because it's nearly different in all individuals. But the one thing that all the patients suffering from eczema have in common is they get red skin, they get inflammation. So one of the things I recommend for my patients with eczema is to use a topical preparation containing vitamin E, because vitamin E is a very potent antioxidant and it's anti-inflammatory. So by reducing the inflammation, we can reduce the redness. However, one last thing I should say, if you do have eczema, it's probably a good idea to consult with a dermatologist, because we should check out what is the origin of the eczema to make sure that you do have eczema. For example, there are other skin conditions that can mimic eczema, meaning it can look like eczema but can be something else. So my recommendation would be to see a dermatologist at least once to get the true diagnosis, to make sure you're using the cream for the right reason.